It's recording.
Dear all, it's my pleasure to welcome you in a new program, which is Simple Talks with Dr. Sabrin. And today my guests are Dr. Ghina and Dr. Leila. Hi to both of you.
Hi.
Yeah, hi. I would like to start this discussion with a simple question, which is if you can introduce yourself. Let's start with Dr. Ghina.
Hi. Thank you, Dr. Sabrin, for giving me this opportunity. I'm Ghina Sawabha. I'm from Jordan. I graduated from RAC Codes in 2018, and I did my internship after that in Jordan, specifically in the Royal Medical Services.
What about you, Dr. Leila?
Hello, I'm Leila Mustawi. I'm Iraqi. I graduated from RAC College of Dentistry in the United Arab Emirates in 2018. Now I'm pursuing my master's degree studies in Turkey, Istanbul, Yeditepe University.
Okay. Dr. Ghina, what you are doing at the moment in Jordan?
Now, currently, I'm a general dentist working in a private clinic, and recently I got accepted in a residency program in the Jordanian Ministry of Health, and I applied for a pediatric dentistry program.
That's very nice. And Dr. Leila, you are studying a master program, as I understood, in Turkey at the moment.
I started my master degree in the same year, 2018. I didn't do the internship in the United Arab Emirates. Here, the system in Turkey allows you to get enrolled in a postgraduate program without having the internship. That's it. I'm trying to get my equivalency certificate. And that's to get to graduate from this postgraduate program.
That's very nice. I believe that majority of those who are going to watch us would ask the most important question is, what are the challenges that you have met after your graduation, your BDS program? Depends on the country where you are at the moment. So let's say, for example, Leila, what do you feel like when you graduated? What was the challenges that you faced in Turkey to get accepted in a master program and to continue your study?
Well, the most important thing in getting enrolled in Turkey is having the Turkish language. For example, it was not a big problem for me since I knew the Turkish language before even graduating from my undergrad university. The challenges, actually, we cannot count them as challenges since my school is a private school. So it was a little bit easier than getting enrolled in a governmental school. Here, you can just apply, have an interview, and according to your interview, they find you enough for them or sufficient for them, then they will accept you. Since I have the Turkish language, I think it was an advantage of being enrolled in this program, and that's it.
So did I understand in a correct way? So if you know the Turkish language, it's a big advantage. How about if you don't know the language? Are they giving you like, a preparation or anything? Any chances for those who doesn't know Turkish?
Of course, they give you 1 year, like you can get enrolled into the program, but they give you 1 year to get the language certificate. So you have 1 year time to learn the language. But at the same time, you will not be able to have patience unless you learn the language well and you are able to talk to the patients, understand them, and communicate with them.
Yeah, that's very important, to be honest, the training, of course. Dr. Ghina, what about you in Jordan? Till now, I was thinking that it's only in Arabic language. Can you tell me if it's a wrong way of thinking or that's true?
Yeah, it's kind of true. Yeah, I don't have any difficulty in language because here you study and your exams will be in English, but the communication with the patients will be in Arabic. So it's kind of my language. So
What
yeah.
about the challenges? How?
So yeah, of course.
About you?
So of course, in the beginning of each phase in your life, you will face challenges. Of course, like
True.
for example, working in a private clinic alone for the first time is a challenge. Applying for a competitive position is a challenge. but it's okay. You can overcome it. You can overcome it. We don't grow when things are easy. We grow when things are challenging, of course.
Exactly.
That's very true. Dr. Rina, to be honest, that's a question even for myself because I'm very interested in that. How about Arabic board? Do you have any idea about that? Is it possible to, if I am a foreigner, to apply for that, or how it works actually?
Yeah, of course, you can apply. Once you get your residency here or master, you apply for a master degree or a residency program here in Jordan. You will have to pass the board exam, the Jordanian board exam. It consists of two parts, part one and part two. Part one, you can take the exam after 1 year of your program. If you're a maxillofacial surgery a surgeon, you're doing the program here. After 1 year of this program, you can take the first part of the board exam.
Okay. Uh-huh.
If you pass it, you will continue the program, of course. And the part two, after you finish this program, after finishing the part two program, you will be a Jordanian boarded dentist in the specialty
Uh-huh.
union.
Okay.
So it's a two
So,
part.
so for so for your master program at the moment, what are the subjects that you had to to revise or to study more, where you feel like the questions were mostly from there, or what exactly was the requirement to go to the to be enrolled in the exam to start the master program in Jordan?
So yeah, now every program you have to take the entrance exam or the exam which, because every program here they will accept the highest dentist. Uh,
Okay.
in every place they have limited number of dentists. Like in the universities, they usually accept two to four dentists, two Jordanian and two non-Jordanian. This will be depend upon the exam. So in my case, in the Ministry of Health, when I applied for the exam was pretty difficult. So
Yeah,
it
we
was
heard about Jordan. Yes.
it was pure basics like anatomy, biochemistry, physiology, with some clinical questions. Because clinical questions are pretty easy. So yeah,
Yeah,
I'm
true.
gonna tell you, if you want to get a very high mark here, you have to go back to year one and year two lectures and revise them, especially for the anatomy. They have like very specific questions for them. But
I guess it's in the majority of countries. If you go to USA, if you go to UK, still you need to go back to, to the basic
exactly,
knowledge.
exactly. Yeah, when we finish these subjects, we say, "Ooh, yeah, this is the last time we were gonna study them," but no, you have to go back to them.
Yeah, that's true. That's true.
Yeah.
I would like to ask about the question. Everyone asked me the same regarding the language. And, since I am half Arabic, half Turkish, and Azerbaijani. So due to that, they do ask me, is it easy to learn Turkish language and is it easy to learn Arabic language? For me, it's difficult to answer to this question because, like since my childhood, I speak both languages. How about you, Leila? What can you say about Turkish language? Because it's a trend at the moment. Everyone wants to learn
Exactly.
Turkish. So, how about you? How did you start to learn it?
Actually, being an Arab learning Turkish is not a big deal. Since we are using a lot of the Turkish words in our daily life, and since it's a trend in currently, it will be easier to learn them since you can see a lot of series, you can buy a lot of books, Turkish books. So learning the language actually started through YouTube. There are a lot of lessons in YouTube. You can watch them. You can learn the grammars there. You can continue to gain more vocab through series, through books, and this is how it goes on. It's not that difficult. Like learning maybe German. German it may be more difficult since it's a totally different language. But in Turkish, it's so similar to the Arabic language.
What
Yeah.
helped you to learn the language? Like maybe you are watching. Did you go to a specific course, or maybe did you watch movies in Turkish? I don't know what helped you exactly, in a very simplest way, because that's a very important question for everyone.
In my opinion, to learn any new language, you have to learn its grammar. If you don't know the grammar, then words and vocab are not going to do anything for you. I learned the grammar from a channel on YouTube. They are teaching Turkish. They have a lot of like level 1, 2, 3. It goes on. You can learn from there, from YouTube. A lot of channels providing this. You can choose the channel that explains the way you think it's easier. Like everyone's brain works in a different way. So like for me, this teacher explains better, but for you, this teacher explains better. So you can choose the channel that is best for you. While my advice while learning these grammars, it will be good to learn new vocab. So as you are learning how to make a sentence, at least you are learning, yeah, at the same time you're learning a vocab, so you can combine both. You can learn a vocab by watching the series, as well. Series like, okay, a lot of people do not like the Turkish series since they are too long, I know that.
Yes.
But exactly, but then if you do not watch their series, you will not understand their culture, you will not understand the way they talk. The Turkish that is written in the books is yeah, it's totally different than the one which is being spoken here in Turkey. While watching the TVs, like when you are talking to a Turkish Turkish person, like you will understand them if you have watched the series. Like you will know what they mean, even their jokes. This is how it works. It will be better, and my advice is to learn how to read Turkish, since the Turkish language grammar is opposite to the Arabic and English. It will be great to learn how to read and understand the readings and the books, because for dentistry wise, they have a lot of dental books that are great and very well written, and maybe way easier than a lot of the English books that I've seen and read before. So it will be an advantage for you. Like you can read the English books as well as reading the Turkish books. It will add to your knowledge.
I
Yeah.
believe that you love Turkish language, since you
Just
are very
continue
excited
with
when
that.
you speak
Continue.
about it. Uh, Dr. Ghina, how about Arabic? Like in Jordan, like what did you feel like? Majority of the patients, they do speak in Arabic language, or
Yeah.
you think English is more important?
No. Here, Arabic is more important. No one speaks English here. Very few people. Yeah.
So
Here,
what would you advise if someone would like to start learning Arabic? How to start that?
maybe my advice is like Layla's advice to watch Arabic series, Arabic.
Oh,
Yeah. So you can know more.
that's also very long.
Yeah. So you can know more about our culture, about that. But it's not that difficult, I guess. Or maybe, yeah, some people say that Arabic is the most difficult language, but
Yeah, in fact, the grammar is not that
yeah,
much easy, to be honest.
yeah. But people here are.
I have
What? Sorry.
no, it's okay, it's okay. You
Add a
continue.
sentence there. Like, I believe that in the Arabic countries, again, if you speak English, again, there are a lot of people who can understand you.
Exactly.
It's not like being in Turkey or being in Germany or being in another European country. In these countries, like they take care of their language very well. That most of the people do not know English even. So in the Arabic world, it's easier to be a foreigner.
Yeah, exactly.
Ah,
So
okay.
here in
That's
Jordan, yeah,
also true. Yeah.
if you can speak English, most of people can understand you, can get your point. So if you speak English here, it's totally okay. Yeah. You can hear me now?
Yeah. Uh, yes, now we can hear you. Yes, yes, yes. It's okay. I have maybe unexpected question. I know you're not ready for that, but what if not a dentistry? What would you choose?
Oh my God. I didn't think of this question.
Yeah.
um, I can't see myself I can't see myself as a dentist, but I would say my plan B was in the high school, the biomedical engineer. So maybe I would.
Okay, but still it's related to the
Yeah,
medicine
exactly,
and you
because
know.
I like the medical field more. Yeah.
What about you, Leila?
Dentistry all the way.
Oh my God, I would choose so many specialities to be honest.
Why
uh, uh,
can't it's in our blood.
yeah, very nice, very nice. You know, I know that both of you studied in UAE, United Arab Emirates, and honestly speaking, it has a special place in my heart since my childhood because I love this country, and I believe for both of you it's the same. So, what is the most that you miss in UAE? About UAE, actually.
I don't know, the community maybe.
Yeah. Yeah,
Do you
people.
feel
The
it's
people, I believe the people there, I don't know about the other Arab countries, but in the UAE, the people are more close to each other. Here, people are
Mhm.
so distant.
Yeah,
Especially Ramadan is coming, yeah.
the social life
What about you, Hina?
social life here in Jordan is more. Yeah, but I miss the UA people more. Yeah,
Maybe I believe that people in the UAE, they're living an easier life compared to any other country.
yeah,
That's
Like
true.
most of the people in the UAE, they are not poor. They are living their life usually and normally. They have whatever they can get, whatever they want. Not like the other countries. So the community in Dubai or in the UAE, they are more relaxed. Like nothing that much, there are no negativities. The people are open-minded. They do not like say, oh, you have this, so don't talk about it. Like there is nothing like that in the UAE, but in the other countries, like there are a lot of communities, there are a lot of social standings there that are different, and may be difficult in the beginning for people who live all their life in the UAE, but then you can get used to it.
and
Uh,
one thing I like
yeah,
about UAE is because it's multicultural, so you can meet people from all over the world. Here in Jordan,
that's
I
very
just meet
true.
Jordanians.
And why you can be judged. No one will judge you for whatever you believe or whatever you think. But when you are living in a country where all the people are living the same life, living the same social life, having the same ideas, it will be difficult to be different. But then again, if I'm talking about Turkey, Turkey's culture is so similar to our culture. That's why it's not that difficult to live here.
That's true. Okay, girls. So I would like to hear from you in a conclusion, because again, everyone will ask the same question. So regarding Turkey and regarding Jordan. So if you would like to, to start living there, for example, let's say in Turkey, what is the requirement to get the master program? And because I know that there is exam, which is called, correct me if I'm wrong, DUS exam,
Mhm.
right?
Exactly.
Okay,
Right.
so yeah, what is the requirement for that? And Dr. Ghina, again, maybe what is important to to start living in Jordan, and maybe to get the the pass to the residency program.
Okay. Living in Turkey is a total different story as a foreigner, and studying is a total different story. Let's talk about studying. First of all, to get involved here, you have to choose to either a private or a governmental school. So the what I found is the easiest way is to go to get a private school, but you have to make sure that the school you're getting in is a internationally ranked school. For example, my school Yeditepe is from the first 1,000s around the world uh, among dental schools. So getting involved in a private school is easier. Why? Because in Turkey, if you have studied, even if you are Turkish, if you have a Turkish passport, if you have studied your undergrad or you got your undergrad degree from another country, you have to have the equivalency certificate.
Yes.
Getting the equivalency certificate, how could it be? Through the equivalency exam. There are two types of equivalency exam in Turkey. First one is the DUS, the Dişte Uzmanlık Sınavı, which is the dentistry specialty exam. It is MCQ, 120 question, 40 questions basic sciences, and 60 questions clinical sciences. Pass it, just to pass it to get your equivalency certificate, you have to get 40 out of 100 to pass the exam. The other exam is it's an interview-like exam. It's called İlmi Hüviyet Sınavı. It's an interview, and there will be a jury judges who will ask you the questions. And depending on the jury, they can also ask you to do a written exam, MCQ exam, or even a practical exam. After you pass these questions and tests, you will be passing the exam by then. There is something else. Most of the countries, like if you have graduated from any Arab country, they will require you the exam, and they will require 33 weeks of internship, which is around 8 to 9 months of internship. Except if you are, for example, if you've studied in Switzerland or maybe Netherlands, then you might not need to do the exam. So you need to ask very well what country you have studied from. Because first of all, you apply, and the application may, you have to apply to the Ministry of Higher Education, and the application duration, it can last 1 year. So after 1 year, they will tell you that we need you to do the exam, and you have to do an internship. Okay, so you have to keep in your mind this procedure. It may take long time. So the second exam, we say the interview, and the first exam is the DUS. You can do which one you ever want, and you need to pass one of them. So getting enrolled in a private school, they do not require you to do the equivalency exam during the application stage. Like they give you, for example, I'm doing masters. My master is 2 years long, so they enrolled me. I started my studies, but at the same time, they are giving me 2 years to do my equivalency exam, getting the certificate, doing my internship, get the equivalency certificate, and then they will give me my master's degree.
So they are quite cooperative, as I understand.
At the private schools, of course, they need money. The equivalency, you need to know that the equivalency stage, exam and internship. Okay, the internship is 9 months. So, for example, let's say I passed my equivalency exam right now. I need to start my internship, which lasts 9 months. So I spend 2 years masters, then exam and internship 9 months, so 3 years. At the end of the 3rd year, I might ask for my master's degree. Okay, yeah. This is for the privates, but they will not give you your master's degree, the certificate, without giving them your equivalency certificate. This is for private. For the governmental schools, for governmental schools, you cannot get enrolled before doing your equivalency exam, before doing your internship. Like you'll have.
So you do advise the students to start with the equivalency before applying there.
Exactly. Even for private schools, like if you have time, if you like, you know, nowadays a lot of people, they cannot find jobs anywhere. So if you have time, wait in your country, try to do the equivalency exam. If you pass, then come and apply. Okay. Even if you want a private school. Here in Turkey, the governmental schools are very well known. They are high. They have a higher ranking around the world, so it will be a great chance to get enrolled in any of them. The governmental school, you need to do your equivalency test as well as the specialty exam to get enrolled in a postgraduate program. Okay, so what is the specialty exam? The specialty exam is the one we said, which is DUS, digital uzmanlık sınavı.
Okay.
Okay, so like for equivalency, you can do either the specialty exam or the interview exam. You pass them, and then in order to get enrolled in a governmental school, you need to pass the specialty exam. You can do the same exam twice. I mean, like their specialty exam, they are using this exam for both equivalency and for specialty.
Okay, that's very wide way of answer.
Like, it's complicated. If you don't get, please tell me so I can clear it more.
No, they will definitely ask maybe in the comments. Yeah, yeah, Dr. Hina. What about you? So we have a little bit time for you as well.
Yeah, because the process here is much more simpler than the Turkey.
Okay, so
here, as you all know, we have two options: the residency program and the master program. Master program, as you all know, it's academic and clinical. And the residency
can you tell us in Arabic? So the residency is اختصاص and master is magister, right?
Yes.
Okay.
The master is magister. The master's program. You have to have a thesis at the end of the program.
Okay. Yeah.
It's without research. It's pure clinical. Here, the master's program are offered by the academic institutions. We have two universities here. The Jordan University in Amman, the capital, and the Jordan University of Science and Technology in Erbil. Now, the requirements for each one is kind of different. The Jordan University, they require 2 years experience for some specific specialties like prosto, ortho. You have to have a 2 years experience after the internship. I don't know if the internship is counted. I'm not sure about it.
Okay.
Yeah, and the Jordan University, the MFD or MBDE are prepared. They give an extra points for everyone who took this board exam before.
Oh, that's great.
Yeah, and you have to have an English, if you have IELTS or TOEFL, you have to do it before the application.
And how many years is that residency?
So for all the specialty in dentistry, it's 3 years, except for the oral surgery and the maxillofacial. Oral and maxillofacial surgery, it's 5 years.
All over the world.
So it's 5 years. Now coming to the residency, you have two options. You can do it in the Ministry of Health and the Jordanian Riyadh Medical Services. Now there is a paid program and the unpaid program. For the non-Jordanian, they can apply to the unpaid. So that means in the Jordanian Real Medical Services, for example, they have to pay them in order to specialize in their hospitals.
Okay.
The requirements, there is no need for the English, I guess, for the residency, but you will have an exam, as I told you before, and there is a competition. You have to be one of the highest dentists in order to be accepted. So yeah, they do an exam and they get the highest. In each year, it depends how many dentists they are accepting. Some years they are accepting 2 to 4 dentists. Some this year they didn't open the program, for example, for the Jordanian Medical Services because they don't need dentists now. But
okay, so they are actually counting the statistics are made.
Yeah,
actually.
exactly.
Okay.
So you have to have in your mind that I have to be the highest mark upon all the dentists, so I can be accepted.
Honestly, girl, that was I enjoyed a lot this discussion with you, and I believe that it was very simple, and that's why we called it Simple Talks with Dr. Sabrin. I would like to thank Dr. Leila, Dr. Hina, and we hope to see you soon in UAE as well.
I'm really thankful for the social media. This is a huge blessing, so we all stay connected. For all of us, stay connected.
Thank you.
Thank you so much.
Thank you. Bye-bye.
Bye-bye.
Bye.
Bye-bye.